So welcome everyone to today's Webinar Wednesday, free webinar from Prevention Plus Wellness LLC, located here in beautiful St. Augustine, Florida. I'm looking out the windows. It's a gorgeous sunny day, 69 degrees, and I hope it's nice where you're at. From wherever you're at, from throughout the country and across the world, we have a super filled session, so I hope everybody's able to get in that wants to view this. But even if you can't, no worries, because it is being recorded, and I will send you a link to the recording, and I will send you a PDF of today's slides. You can see today's topic: screening and brief intervention practice for youth, substance use prevention and wellness. So we've got an hour together. As we are meeting, if you have questions or comments, you could jot those down in the chat option or the Q&A option, and we'll look at those at the end of today's presentation. We've got lots and lots of slides, so I'll probably go through them fairly quickly because I like to have more time at the back end for discussions and for Q&A. But we'll see how it goes today. So because this has been presented before, but I have updated this more recently, added some more slides, changed a few things. So this is the most recent version of this webinar. And my name is Dr. Chudley Wirch. I'm founder and CEO at Prevention Plus Wellness. So 4 objectives for today's session. You can see them here. We're going to identify various screening and brief intervention, or SBI, practice models that can be used for preventing and intervening with youth substance use. Number 2, we're going to explore evidence in systematic reviews, as well as, individual peer-reviewed articles supporting screening and brief intervention for preventing youth substance use and promoting wellness behaviors. Thirdly, we're going to examine screening and brief interventions as SBIs. I'm sorry about that. Screening and brief interventions found in evidence-based programs registry. So in other words, we're going to look at research, then we're going to actually look at evidence-based screening and brief intervention programs listed in registries. Lastly, number 4, we're going to talk about implications for you as prevention and health specialists. Professionals. So, all right, lots of things to look at. Let's start first of all with screening and brief intervention practice models. So to start out with, that first bullet is actually something I read from SAMHSA a couple of years ago, and you'll see similar descriptions of screening and brief interventions online in the literature, but here's one. Screening and brief intervention is a public health approach. In other words, it's meant to really reach large numbers of individuals. It's evidence-based practice, and that's the case, and it will show you here in just a moment. It's considered evidence-based practice that is screening and brief intervention by a number of federal and international agencies. Screening and brief intervention is designed to motivate individuals who are at risk for substance use disorders and related health problems. That could be young people, it could be older people, it could be anyone in between. And the goal of screening and brief intervention is to change their behaviors. It's a motivational intervention, not so much education, as the goal is to change behaviors by helping individuals, whether they're young or old, understand how their substance use puts them at risk and helps them to reduce or give up their use. That was the SAMHSA original description, but from a prevention perspective, obviously, to prevent them from initiating use, sort of to postpone, if not prevent entirely, the initiation of substance use. Or if we are looking at other behaviors, let's say a wellness behavior like physical activity, a screening and brief intervention would be designed to promote or to initiate more or new physical activity, or more regular, or different types, etc. So what are some models of screening and brief intervention? Here's 7 of them here. There's a lot of different names and titles for these, But these are some of the more common. So brief intervention, you'll see that a lot in the research literature, just identified as BI. And that's a little bit a broader type of a thing. BI, brief intervention. However, by the way, oftentimes there's no agreed upon definition for these things. So for a brief intervention, that could be a single session, it could be 6 sessions. It all depends on who's using that term and what they mean by that term, brief intervention. And brief intervention could be anything. It could be any kind of intervention. It could be an intervention, it could be pharmaceutical for that matter, but most often brief interventions we're talking about here, at least, we're talking about psychoeducational kinds of interventions. Number 2, screening and brief intervention will focus mostly on that. That tells you it's a certain type of an intervention. It's screening and then brief intervention. Usually that includes screening and then feedback and maybe even something else. And in fact, that something else could be number 3, SBIRT, which is screening, brief intervention, and then referral to treatment. Screening, brief intervention, and then for the high risk, referral to treatment. We'll talk more about that. Motivational interviewing is number 4. That's a counseling system, open-ended counseling approach. And usually that's quite brief as well, and it focuses on motivating individuals to change their behaviors. Number 5, single session intervention, SSIs, single session treatment, SSTs, and so on. Those are terms more readily used in the mental health area, psychology, for example, for mental health intervention or treatment, SSI. That just means literally it's a single session. PPW is a term that we use here, prevention plus wellness. Prevention plus wellness programs, all of them are brief. They're all motivational. And the unique part is that you can tell by the title, they're not just aimed at preventing substance use or risks, but also promoting protective wellness behaviors. That's the PPW model. More about that later. And lastly, one more model, which you can learn more about and is very interesting. And in fact, some of these other models, some of these other programs, whether they be a brief intervention or an SBIRT or motivational interviewing, will use the frames model for creating their intervention or their content and their strategy. Frames stands for, as you can see there in number 7, feedback. So you provide feedback to youth, you identify them as being responsible, you provide advice, you give them menus of options for change, use empathetic communication, and you help your clients or your youth or your adults individually or in a group increase their self-efficacy or their self-confidence to make a change in their life. So that's the frames model. So those are all different related models and terms used in the brief intervention world. Now, these are some of the agencies that have identified screening and brief intervention, that particular type of brief intervention where there's screening and then there's a brief intervention follows, as evidence-based practice. So we're talking about evidence-based practices, which is above a specific evidence-based program. You have a lot of evidence-based programs, could be sport prevention plus wellness, in shape prevention plus wellness, life skills training, etc. These are individual, they could be prevention, they could be mental health, they could be treatment, they could be a lot of things. But those could be evidence-based programs that have had researched and found effective. But at another level, a higher level, is an evidence-based practice. So that's what screening and brief intervention is. So you can see that these are some of the agencies that have identified screening and brief intervention as evidence-based practices. SAMHSA, the Substance Abuse Mental Health Services Agency, has identified that particular type of model. In fact, they came up with that model, I believe, SBIRT, screening, brief intervention, referral to treatment, as evidence-based practices. CDC has identified alcohol screening and brief intervention, evidence-based practice. The World Health Organization, WHO, identified SBI for substance use problems. NIAAA, the National Institute on Alcohol Abuse and Alcoholism, has identified Alcohol Screening and Brief Intervention for Youth as Evidence-Based Practice, and the American Academy of Pediatrics has identified substance use, SBI, for youth as evidence-based practices. So these are all of different agencies that have identified screening and brief intervention for youth, for adults, for alcohol, for different substances, et cetera. And, because I'll be sending you this a PDF of this these slides, you'll be able to click on these links and learn more if you'd like to. Let's start by taking a look at just a couple of studies of research which supports screening and brief intervention for substance use prevention intervention. So this is a study published in 2008, I should say. It's not a study, it's a review of research. In fact, it reviewed research in the screening and brief intervention area. It's actually SBIRT, Screening, Brief Intervention, Referral to Treatment. They looked at the SBIRT research over a 25-year period and to see how effective it has been. And under number 2, they found that starting in the 80s, they were able to identify over 100 clinical trials that examined the efficacy and the cost effectiveness of screening and SBIRT for impacts on alcohol use. Then in the 1990s, they found more research that looked at SBIRT effects on other substances beyond alcohol, illicit drugs, tobacco, prescription drugs, for example. And that research has continued today. Looking at SBIRT, looking at SBI, looking at other brief interventions for the impact on specific types of substance use. Of course, right now, newer substance use, for example, vaping, and both as an intervention as well as a preventive program or strategy, and even on wellness behaviors, even for promoting physical activity, healthy eating, et cetera. SBI yields short-term improvements on individuals' health. That's irrefutable based on this research. And lastly, long-term effects have not yet been demonstrated, but that said, the simulation models have suggested that the benefits could be substantial over time for SBIRT, and I would say that goes for other screening and brief intervention models. One other review that I wanted to show you before we look a little bit more focused on youth is that here is a review of a brief intervention for cannabis use disorder. And the results were that the majority of the studies pointed toward the effectiveness of brief intervention for reducing cannabis use or its associated consequences. And these authors, these researchers concluded that brief interventions might be useful for the mild to moderate cannabis users. So we're talking about an intervention, brief intervention for intervening with already existing cannabis users. So, but what we're going to do is we're going to be seeing some of these other reviews and studies are sort of raising some questions about that. So I think that's still the jury's out on what types of brief interventions may or may not be helpful in impacting, preventing and reducing cannabis use among various populations. Let's take a look at research supporting screening and brief intervention for youth substance use prevention. Here's a review of alcohol brief interventions for adolescents, published 2015. They concluded that brief alcohol interventions for adolescents as well as young adults yielded modest beneficial effects. These effects lasted for up to a year later. They found that goal setting was associated with the larger effect sizes. Keep that in mind because this idea of goal setting will come back in the future, in a little bit as we continue to discuss this. Goal setting can enhance effects. And lastly, number 5, effects are consistent across diverse settings, formats, and populations. So this was a really important study indicating a review of studies, I should say, indicating the brief interventions for adolescents and alcohol use, adolescents and young adults, and the effects on alcohol use, very positive. Then there was another review published looking at, which I should say, SBIRT for adolescents again, and broadening it to look at just substance misuse, not just alcohol. These research identified the fact that in 2011, the American Academy of Pediatrics released a policy statement recommending the use of SBIRT for youth. In other words, they identified SBIRT as an evidence-based practice. So these authors that reviewed these studies recommended that pediatricians should be screening adolescents for substance use at every well exam, as well as acute care visits, and SBIRT is an effective method for addressing adolescent substance use. So broader than just alcohol, but this is limited to, and much of the literature on screening and brief interventions is limited to clinical settings, doctors' offices, emergency settings, pediatricians' offices, and so on. So we're going to take a look at other settings other than clinical settings, a little bit broader, more school and community-based for those of you that may be in those settings. Here is a meta-analysis. It's a statistical analysis. It's a review of research on brief intervention for substance use in adolescents. And this was to synthesize the research for adolescents ages 12 to 20 with problematic substance use. So these are already substance using in the youth, adolescents, and they use motivational interviewing. That's that counseling approach, and they found that motivational interviewing reduced heavy use, alcohol use days, and substance use related problems in adolescents, but it didn't reduce cannabis use, which is interesting. So these are among substance using adolescents. So it's really an intervention found to be effective for alcohol use and a number of measures for adolescents, but not cannabis. Here's a review of single session interventions for youth mental health. So I just wanted to show you one of these reviews, so introduce you to this idea of SSI, single session interventions, which is a term used more in the literature in the mental health area. And these authors, these researchers said that the SSIs offer a promising path toward improving accessibility, cost effectiveness, and completion rates of youth receiving mental health services because they're single session. The structure for these programs are intentionally involve only one visit or one encounter in a clinic, a provider, a program, and they may serve as a standalone or adjunct with other programs and interventions. And there's a growing body of literature, these authors concluded, of evidence supporting the capacity of SSIs as screening and brief interventions to reduce and prevent youth psychopathology of multiple types. So again, a little bit broader, they're looking at mental health, but we're in the behavioral health field. Here's a review of brief interventions for cannabis use among emerging adults, in other words, young adults. So they defined brief interventions as operationalized as 1 or 2 sessions, and that focused specifically on cannabis use for young adults ages 15 to 30. They found most interventions in the literature were motivational, single session, delivered in person. They found that brief interventions show benefits for symptoms of cannabis use disorder, as well as benefits for increasing abstinence. And they reported that the interventions in the published research showed that brief interventions show promise for other outcomes as well. And they recommended more research on higher risk populations. So here's a review of research for young adults showing cannabis brief interventions showing some important promise in reducing use and increasing abstinence. This review of studies, and I think reflects a lot of what we're seeing, where we're seeing a translation of these brief interventions into computerized formats. And so this is a review of computerized brief interventions for young people. They found that interventions significantly reduced alcohol consumption compared to no intervention at all, but the effect sizes were small, and there were no significant effects long-term. Interventions that they reviewed, that these researchers reviewed and saw in the literature, provide an assessment of alcohol use with feedback that may have a larger effect than those who didn't have feedback. But again, the evidence is rather weak. So screening and feedback seem to be better than interventions that didn't have that feedback. A few studies on cannabis did not show significant effects on reduction, and computerized brief interventions seem to reduce alcohol use among young people, but not so much cannabis. So this review, again, focused on the computerized rather than the implementation in person. This is a computer, and so they're showing, looks like these computerized brief interventions can be effective for young people, particularly for alcohol use. This review looked at interventions for substance use disorders in adolescents. It was a systematic review, and it was very broad, by the way. It looked at behavioral interventions, pharmacological interventions, combined interventions for adolescents ages 12 to 20 with problematic substance use or substance use disorders. And now let's just look at the motivational brief intervention piece. That's number 2. They found that motivational interviewing reduced heavy use of alcohol, and the evidence was low. Alcohol use days, the evidence was moderate, and the reduction of substance use related problems, and the evidence was relatively low, but did not reduce cannabis use. Okay, so motivational interviewing was found to have effects on several measures of alcohol, but not cannabis use. On the other hand, screening, I should say, these brief interventions in college settings were supported by the literature for students with any use, heavy use, or problematic use. So some evidence, once again, looking at, in this case, motivational interviewing, that's that open-ended counseling approach for reducing adolescent and even young adult college use alcohol consumption. This review was on brief interventions on internalizing symptoms and substance use abuse. So this is a combined. I wanted to give you a little sense of some of the literature that actually looks at beyond just substance use itself. This makes sense because this is, mental health area. They're looking at both internalizing symptoms like depression and anxiety, as well as substance use. And this is a review of research just published this year. And they found that 3 to 4 interventions significantly reduced alcohol internalizing symptoms. 3 to 5 interventions reduced substance use. 2 to 3 interventions were found to reduce both internalizing symptoms and substance use. All 6 interventions identified substance use as the primary target. In other words, these were interventions aimed at reducing adolescent substance use, but also seeing if those effects those effects also included mental health effects. And these interventions ranged in length from approximately 50 minutes to 240 minutes. That's quite a range. And these authors said future investigations of brief youth-focused interventions should assess program effects on both of these factors, because they found some evidence. They found some evidence or some interventions, at least 2 to 3 interventions or 2 to 3 papers of interventions where they found positive influences on substance use for adolescents, as well as improvements on internalizing mental health symptoms. And then this one individual study I showed because it's unique in that it focuses on schools rather than clinical settings for implementing brief interventions for youth. And the aim of this particular project was to look at implementing screening and brief interventions as a universal program. In other words, all youth in high school without a school-based clinic. In the past, there have been other studies that have looked at brief interventions in school-based clinics because that's a clinical setting. There are over 2,500 9th and 10th graders in 10 schools, and they found that screening SBIRT, that's again screening, brief intervention, referral to treatment, had potential to delay substance use among current abstainers. In other words, a true prevention effect. So they concluded that this project demonstrated SBIRT's feasibility as a universal method for high schools without school clinics. Let's now shift gears to look at research supporting screening and brief interventions for youth with multiple risk behavior prevention, focusing on not just substance use alone, but other health behaviors. And here's a good review published a couple of years ago that looked at physical activity interventions for adolescents. And the results suggest that physical activity interventions may decrease substance use in teens. Most of the studies looked at group sessions, but some and others were actually just a single one-time multi-health consultation. In other words, some of the interventions were like brief intervention or screening and brief intervention. They were found to decrease substance use, and at the same time they addressed physical activity. So these authors of this review of research concluded that school-based interventions targeting multiple health behaviors, in other words, physical activity, maybe some others, and substance use, offer a particularly effective and efficient way to decrease substance use among adolescents. So this was looking at, again, interventions and studies of interventions that address physical activity and substance use. We've conducted our own research of the evidence-based SPORT, the Alcohol and Drug Prevention Plus Wellness Program for Youth. Our research has been published in peer-reviewed articles in these 4 journals. And just to summarize the effectiveness of the single session SPORT screening, feedback, goal setting, in other words, it's a screening and brief intervention, which we call a PPW program or Prevention Plus Wellness Program, had these effects: significantly decreased alcohol use, initiation, quantity, frequency, binge drinking, alcohol problems, significantly increased physical activity. That's because it's a integrated program. It addresses not just substance use, but wellness behaviors. Reduced cigarette smoking with some effects a year later among high risk already using substance using youth. Number 4, reduced binge drinking, smoking, marijuana, increased physical activity even a year after the program. Increased parent-youth communication. We did one study of parent-youth flyers with the same content, and it was found to reduce alcohol use, problematic marijuana use, and increase parent-youth communication. And lastly, number 7, very interesting, we had a translation of the SPORT PPW program into Turkish language, and it was implemented as a part of a controlled study by a nursing student in Istanbul, and they found, that person found, that the SPORT program improved a number of health indices, including physical activity, nutrition, sleep, and even mental health. So that was a fascinating translation of showing you, I think, the robustness of the Prevention Plus Wellness screening and brief intervention model. InShape is a screening and brief intervention program for young adults, evidence-based, has been published, peer-reviewed, published articles in these 4 journals. And to review, just to summarize on a single page, the outcomes from these studies of the InShape PPW program, which, by the way, is now being used in college campuses, communities, even the US Air Force, has the research shows that the InShape program reduced the frequency and heavy use of alcohol, as well as marijuana, as well as drinking and driving a year later, increased sleep, exercise, healthy eating, and very interestingly, number 5, improved social and spiritual health-related quality of life. These are self-reported quality of life. Less intentions to drink, smoke, and use marijuana on a computer-based version of the InShape program, and improved body image satisfaction. So good outcomes from InShape with young adults. So what can we conclude from all of this literature that we've looked at thus far? I would say screening and brief interventions are evidence-based practice for preventing and reducing alcohol and substance use, other risk behaviors associated with mental health, and the physical health of youth. Number 2, prevention and health professionals can use screening and brief interventions as standalone or adjunct programs added on to other prevention interventions treatment, not just in clinical settings, but in school settings, community settings, campus settings, as I said, US military, wherever there's youth or young adults to reach full public health impact. Thirdly, multiple risk behavior screening and brief interventions for youth and young adults may be more cost effective and time saving than single risk behavior programs. In other words, there's nothing wrong with a program aimed at reducing opioid use, but a program that addresses opioid use and other risk behaviors like physical inactivity, poor nutrition, inadequate sleep, uncontrolled stress are likely to be time saving, cost effective, and maybe even increasing the breadth of outcomes by integrating those behaviors within a single intervention. Now let's look at evidence-based screening and brief interventions for youth and young adults. So here, what we did here was we went to the Results First Clearinghouse database. This is a Pew Charitable Trust Foundation, Charitable Trust supported website. It's actually a meta-database because it actually is a database of 9 individual evidence-based programs and practices registries. So it's not just a single registry like NREP or Blueprints for Healthy Youth Development. Actually, Blueprints and Healthy Youth Development are part of the Results First Clearinghouse database. So if you're going to look for evidence-based programs, this is the one to go to because it's the largest. And so we went to this database, this meta database. We put in the term, we looked at substance use outcomes, then we added the terms brief intervention, and that search came up with 61 programs. Then we added screening and brief intervention format, youth or young adults, and prevention or intervention and non-clinical settings. And we ended up with 11 interventions, 11 evidence-based screening and brief interventions, all right, for youth and for young adults. Let's take a look at them. One of them, it was titled Alcohol Brief Interventions. We've already seen the literature just a few moments ago, the effectiveness of this. And you can see the description here of brief alcohol interventions. Provide information, increase motivation for change, or problematic alcohol consumption in a short session. This description is sessions last from 5 to 10 minutes with a maximum duration of an hour. Oftentimes include screening, feedback, and advice and decision-making to support and encourage change. So again, this really sounds like really a description of screening and brief intervention. And you can see the outcomes that this evidence-based program has found for alcohol use and excessive drinking, reduced underage drinking, and alcohol-related harm or problems. Okay, that's alcohol brief intervention as identified as an evidence-based program. Computerized brief interventions for youth, alcohol use. Again, now focus on alcohol, but the shift is to computerized. And so this database found computerized brief interventions that's as effective for prevention or therapeutic activities, and it's delivered online or offline electronically. And they also included cell phones and tablets and computers. So this is, and we're seeing a trend here, expanding use of technology to provide interventions, brief and otherwise, to youth as well as adults, for prevention, for health promotion, mental and physical. Number two, similar to brief interventions, computer interventions were short in duration. They aim to make individuals think about differently about their alcohol use and provide them with skills to change their behaviors for ages 15 to 25, and the outcomes were in the alcohol area. That's computerized brief interventions as evidence-based programs. Another area, this was found on the registry as evidence-based program, targeted brief alcohol interventions for alcohol use for adolescents and young adults. I really wasn't sure what the difference was between, alcohol brief interventions and targeted, although it seems like they were looking at targeted populations, so ages 11 to 17, which is the adolescents, or 18 to 30, which is the young adults. But these were brief alcohol interventions to reduce alcohol use or alcohol-related problems. And again, evidence-based programs. And the difference here was that the third bullet was that these can be used as universal or selective or indicated prevention strategies. In other words, universal for all youth or young adults, as well as selective for higher risk youth and young adults, or indicated those with substance use problems already. Teen Intervene is a specific program found listed as an evidence-based program. Brief early intervention for 12 to 19-year-olds that are displaying early alcohol or drug involvement. And so this was a good program because it was found to have influence on not just alcohol use, but other substance abuse and dependence. That's Teen Intervene. Brief alcohol screening and intervention for college students, referred to as BASICS, B-A-S-I-C-S. Harm reduction approach by Alan Marlatt, who unfortunately is no longer with us, but he did some tremendous research and development of programming when he was with us. And it's a preventive intervention for college-age students, targets students who drink alcohol heavily or they've experienced problems. And so this is to reduce their problems and their use and their problems. So the program's conducted over the course of 2 brief interviews that prompt students to think about and change their drinking patterns. So this is the BASICS program. And this is really a foundational program because from this, other programs have been developed. For example, the STEPS comprehensive alcohol screening and brief intervention for college students was based on or founded on the BASICS model. And the STEPS program is used primarily for 3 groups of students: first-year students, students seeking mental or physical primary care health on campus, and student athletes. And they found some good effects on alcohol as well for college students. Another program founded on BASICS is the College Drinker Checkup. This is a computer-based program, and this was found to have outcomes on alcohol use among college students. And the core elements of this College Drinkers Checkup is the FRAMES program. Remember the FRAMES strategy, the FRAMES model, F-R-A-M-E-S? That's how they came up with the core elements for this College Drinkers Checkup, or CDCU intervention, which is identified as an evidence-based program. My Student Body, another online subscription, another online type of an intervention, motivational feedback for young adults based on BASICS as well. And then there's motivational interviewing, which I had mentioned to you earlier. It's goal-directed, it's client-centered, it's a counseling style or approach. So it's really open-ended. It's not as scripted a program as some of these others you've seen, whether they're in person or online. So the operational assumption, which I think is interesting among motivational interviewing MI, is that people young and old are ambivalent about their their lifestyle, their behaviors, and they lack resolve to make behavioral changes. So that's what you're doing with motivational interviewing. You're really addressing that ambivalence and increasing their motivation for change. And so MI has been used for a broad range of substance use, found effective: alcohol, drinking, driving, cocaine, opioids, etc. In Shape is our program, one of our evidence-based programs. It's unique in that it integrates the prevention of alcohol and marijuana with the promotion of protective wellness behaviors, physical activity, nutrition, sleep, stress control. And so it's an integrated intervention. It's based on the behavior image model, which integrates self-regulation theory and positive image theory. And the idea here is that you use naturally motivating future images, self-images of youth, and you show how substance use interferes with achieving those images and those benefits. And that way you're able to integrate these messages and increase motivation for multiple behaviors. And then you use goal setting to initiate behavioral change and eventually to increase self-regulation skills for young people to shape their own behaviors. In Shape is for young adults. And again, as I said, it's been used on college campuses and community settings in the US Air Force. And effectiveness, as we've seen earlier, on alcohol, marijuana, health-related quality of life, et cetera. Sport is the original integrated program. It's for youth. We already talked about sports. Sports identified as an evidence-based program. Impacts on not just substance use, but physical activity and other risk behaviors. And so a good program if you want to have a single session program that integrates not just substance use prevention, but the promotion of wellness behaviors. So what can we conclude from this information, this research? Evidence-based screening and brief interventions are found in multiple evidence-based practices registries. And this supports the research that we looked at about screening and brief interventions as evidence-based practice and programs. So you got plenty of evidence-based programs, you got evidence-based practice, which is above that, and that's what screening and brief interventions are. There's a considerable number of evidence-based screening and brief intervention programs for preventing and reducing primarily alcohol use, but also other substances, and for improving other health behaviors for adolescents and young adults. Number 3, prevention and health professionals can choose. You can go to that registry. Let me go back there and look at it one more time because I sometimes forget the title of it. Go back to this registry, this large registry called Results First Clearinghouse Database. It's a meta database of 9 evidence-based programs registries. You can go there and you could search for and choose from, oops, I'm sorry about that. You can go there and search from evidence-based programs, screening and brief intervention programs that are either in person or implemented electronically, focused on alcohol or other substance use, prevention or intervention for adolescents or young adults, and addressing substance use alone or substance use and other healthy behaviors, other risk behaviors like physical inactivity or poor nutrition. Now let's take a look at multi-risk behavior screening and brief intervention, specifically the prevention plus wellness model and programs. It's a 3-step process, 3-step model. Step 1, screening youth, usually youth or young adults, for their current health habits to increase individuals' understanding and awareness of their behaviors. A lot of times we go through life, we're not really even aware. We're in a trance, if you will. Trance, we're walking through life, and young people especially seem to be like that. And so increasing their awareness of their behavior, specific behavior, is very important, not just substance use, whether it be alcohol or opioids or vaping or marijuana or what have you, but also how, physical activity and breakfast and nutrition and sleep and stress control. Secondly, is to provide feedback and positive image messages using a script. PPW uses scripts and PowerPoint slides, and this integrates the behaviors. It integrates substance use avoidance with healthy behavior promotion. And this is designed to increase motivation for change, because you're saying, hey, look at, you can be more active, fit, healthy, successful, and alcohol and drugs interferes with that. That motivates a desired behavioral change. And then you take advantage of that in step 3 by walking your youth or your young adults to set and monitor goals, not just avoid substance use, but to increase protective wellness behaviors. This initiates behavior change, which is so critical. They monitor their behaviors, and over time, they can develop self-control skills to start shaping their own behaviors. So what is the difference between screening and brief intervention, or SBIRT, and PPW, prevention plus wellness, screening and brief intervention? Let's take a look on the left. On the left, you see screening and brief intervention and SBIRT, some of the core elements to it. Number 1, it assumes individuals have ambivalence about their behaviors, and so that's why they don't change them. Number 2, you screen for the purpose of identifying those at higher risk for substance use, that's SU. Number 3, you provide feedback and advice on substance use behaviors to those that are at high risk, HR, individuals. Number 4, you refer high-risk individuals to treatment if they need it. And number 5, this type of an intervention, SBIs, SBIRT, usually provided in clinical settings, in doctors' offices, primary care, pediatricians, etc. Now let's contrast that to the right of the prevention plus wellness screening and brief intervention model. PPW SBIs is based on not on the focus on ambivalence so much as the behavior image model, which I'll define for you here in a moment. Number 2, you screen not for the purpose to identify those at higher risk, but to increase awareness of substance use and healthy behaviors among those who you are providing the programs to. Number 3, you provide feedback and advice on substance use and healthy behaviors and how they interact with each other for everyone. In other words, everyone is receiving this feedback, not just high-risk youth individuals. Number 4, you conduct multi-health behavior goal setting, contracting for all participants to start that behavioral change. And number 5, it's usually done, PPW screening and brief interventions are usually done not in clinical settings, although they certainly can be, but more often than not in all 50 states and across in other countries, in school settings and community settings. So that's where PPW, prevention plus wellness screening and brief interventions, are more often used. Screening, prevention plus wellness screening and brief interventions have used the FRAMES model for the setup, for the content. So FRAMES, by the way, again, refers to feedback, responsibility, advice, menu, empathetic, and self-efficacy. So let's start with F, feedback. So prevention plus wellness programs, whether they're sport or in shape, marijuana PPW, vaping PPW, opioid PPW, etc. All of our programs, even our parent training programs, we use feedback on personal risk. In other words, substance use harms wellness behaviors and positive identity. That's the feedback that's presented. I just showed you PPW programs use this 3-step process, screening, feedback, goal setting. Number 2, responsibility, or I should say R, responsibility of the individuals. It's your choice to change your behaviors, but we do encourage that, a reflection on that. That's why responsibility is addressed in the prevention plus wellness programs. Advice to change, and the advice provided is to increase healthy behaviors and to avoid substance use behaviors. M, menu of goals and strategies. We give youth and young adults the ability to choose from a set of behaviors or goals to monitor multiple behavior change. Okay, they get to choose the goal, so they can choose whether they want to set a goal in the area of physical activity, breakfast and nutrition, sleep, stress control, etc. Number E, or letter E, empathetic, positive, and supportive communication and images are provided in PPW programs. Self-efficacy is communicated by highlighting optimism, that young people can set goals to make positive change in their life and improve how they feel and look. And you can learn more about frames on that last line there if you want to click on that. All right, what is the behavior image model that underpins prevention plus wellness, screening and brief interventions? BIM, behavior image model, wellness related, a theoretical roadmap, if you will, for creating interventions. We have created brief interventions. All but one are just a single session. Sport 2 actually has 6 sessions, so that's our longest program. But the idea of the behavior image model is to integrate the promotion of wellness behaviors and images and benefits with the avoidance, reduction, and prevention of risk behaviors like substance use. For example, promoting physical activity and preventing alcohol. See how they're linked? Promoting healthy eating while preventing vaping e-cigarettes. That's the linkage there. There's that linkage that allows multiple behaviors to be integrated in PPW programs because we're using the behavior image model to create them. The behavior image model highlights 2 key elements. Number 1, communicating positive, aspirational peer and social future images as values. And this connects and increases connects behaviors, I should say, and increases motivation to change substance use and wellness behaviors. And then secondly, capitalizing on that increased motivation by using multiple behavior goal setting to initiate action and then eventually over time increase self-control. This is the modified behavior image logic model. You start at the top, the arrows go down. You communicate as a professional, or you can train parents to, if you wish, with PPW programs to communicate behavior image messages that integrate wellness with substance use. This cues unconscious future images of youth, unconsciously images of them, again, being healthy and fit and active and successful. This increases awareness of their wellness images as values and risk behaviors as undesirable. This enhances motivation to set multiple behavior goals. And by setting and monitoring multiple behavior goals, that initiates the behavior change and over time increases self-regulation skills. These are some of the prevention plus wellness screening and brief interventions. We got sport, which is our alcohol drug PPW program for youth. We got high school, middle school, elementary school versions. In Shape is our alcohol drug PPW for young adults, but like I said, it's being implemented not just in college campuses, but communities in U.S. military. Our marijuana PPW program and our vaping e-cigarette PPW program, we have high school, middle school, elementary school versions. We've got an opioid prevention plus wellness program, versions for adolescents, as well as high-risk young men and high-risk young women. We have a racial justice PPW program, which targets racial discrimination as a known risk factor for substance use. In God's Image is our free faith-based PPW program. Sport 2 is our only multi-session program. It's 6 sessions, and we have PPW for parents. So we could train you to train parents to provide the same positive image and behavior communications and goal setting at home that you can present directly to youth with our other youth programs. All right, so final conclusions and implications. Number 1, PPW screening and brief interventions are similar to other screening and brief interventions. We use the frames model, for example, but they also differ from typical SBIs, and experts, both in practice and theory. Number 2, prevention plus wellness screening and brief interventions are based on the behavior image model. They can be used as prevention by prevention and health professionals. We've even trained youth to implement them to their peers, like high school youth. And the advantage of PPW SBIs is that they integrate substance use with wellness habits. Number 3, an increasing growing number of PPW screening and brief interventions exists. We originally started with sport and then In Shape focused on alcohol. Since then, we've created programs to address other emerging substances, opioids, e-cigarettes, marijuana, even racial discrimination, different formats. We've got a video program. And of course, now we have a parent program, parent training program. So a lot of development over the past 11 going on 12 years. Here are some resources for you that are free that I thought you might be interested in looking at. SBIRT for school social workers. Even if you're not a social worker, I think you'll find that interesting. Alcohol SBI for youth is from NIAAA. Substance use SBI for adolescents from the American Academy of Pediatrics. Youth SBIRT in primary care. And a learner's guide to adolescent SBIRT. All really good information, and I'll send you a PDF of these slides so you can click on these links and explore some more. If you want more from us, if you want to see more about prevention plus wellness screening and brief interventions, you can go to our website, preventionpluswellness.com. We have a link here on the left, that's to our catalog, online catalog of programs and training. We also, you can also sign up to get a sample of any of our programs, an e-sample, as well as just drop in your email for our weekly our weekly webinars that we present. All right, preventionpluswellness.com is our website. info@preventionpluswellness.com is our email. 904-472-5022 is our phone number here in the office in St. Augustine. And that's it. So I'm going to pause at this point and see if anybody has any questions. I'm going to open up the chat space. Let's see here. Belize, Nashville. Okay. Hello, Chudley. Will we be getting a copy of these slides to use? Everybody in Union? Yes. Yes, you will, Anne. I'll be sending you the slides. I'll be sending you a certificate for 1 hour CEU. I'll be sending you a link to this recorded training session. All of that you'll be getting sometime today. Don't need to email me. If you don't find it, check your spam. Sometimes because of the attachments, it'll be sent to your spam folder. So thanks for asking about that, Anne. All right, we have just a couple more minutes. Any questions, any comments, anything that wasn't clear? Went through a lot of material very quickly about screening and brief interventions as evidence-based practice, screening and brief intervention, individual evidence-based programs, different kinds focusing on different age groups and different substances, and even multi-behavior programs that are, I think, our unique area of interest. And so you've got a lot here, a lot to look at and to think about. And so I don't see anybody with any questions or comments. I don't see anything at this particular time. So I'm going to say, God bless you, as I always do, for what you do for youth and families in your region of the country and world. Let me know if we can help you in any way, provide you with any resources. Go to our website, check it out. We have things that are free. We have things that you could pay for, and everything in between. So training, programs, lots of good stuff. Those of you interested in preventing substance use and promoting youth and young adult overall health and well-being, physical and mental, check out our website. And thank you so much for the compliments. You'll be hearing from me in an email today. So have a great day, everyone. Thank you for joining us. Keep up the good work. Stay safe and stay healthy. Okay? All right. Bye-bye, everyone. Thanks for everything. Thanks for joining us.